A number of Democrats running for office this year, like New York congressional candidate Alexandria Ocasio-Cortez, are advocating for national health care legislation proposed by Vermont Senator Bernie Sanders, who lost the 2016 Democratic nomination for president to Hillary Clinton. Sanders' plan would expand Medicare, a government-funded health care program for senior citizens, to cover all Americans. Other Democratic contenders like Beto O'Rourke, a candidate for the Senate in Texas, support increased federal regulation to hold down costs, but are not calling for a complete government health care takeover.
The thing that is common among these different reforms is the structure of a government-administered insurance plan that really controls or limits in some respect the payment rates that are paid to healthcare providers.
Republicans successfully ran against the Affordable Care Act, sometimes called Obamacare. The GOP rallied against it as a big government attempt to take over the healthcare industry to gain control of Congress during former President Barack Obama's time in office. After failing to repeal Obamacare and with healthcare costs rising, some Republicans now say they support a major tenet of the Affordable Care Act to protect people with pre-existing conditions, such as heart disease, diabetes, or cancer. Critics say their sudden conversion to support this issue is suspect. 4 conservative-leaning states will also hold ballot initiatives to vote on expanding Medicaid coverage for the poor, a benefit offered under Obamacare, 90% of funding coming from the federal government. Republicans argue that public support for universal health care will decrease significantly when confronted with the prospect of increased taxes and the rationing of coverage that would likely result from a national health insurance plan.
This is all what happens when you have the government controlling healthcare costs, because now it's a singular, consolidated entity making decisions on behalf of 300 million Americans.
Even if Democrats make significant gains in Tuesday's election, it is likely they will not have the votes to pass major health care legislation. But the election momentum could increase support for a compromised approach to regulate costs, but also foster private sector competition. Brian Padden, VOA News, Washington.